I start. So hi friends, we have this special lady with us. She's traveled several thousand kilometers. She stayed with us for 2 weeks almost. She's going to go back to her country where she came from. She originally, however, from our state of Tamil Nadu in South India. Right, so what have we done for her? We've literally done a face makeover. We're also planning to give her a new smile, that is a full set of teeth. So if you see, this is how she came to us. You know, her main concern was she was looking aged more than her real age, and she was concerned about these deep grooving. She was concerned about the lower lip. She was concerned about loose skin around the eyes, around the chin, jowling, everything. Do we have some other views? Yeah, you can see the side view. So these were all her concerns. And we did a proper analysis of her facial skeleton, of her concerns, soft tissue analysis, and I decided that we do a combination of hard tissue and soft tissue procedures. Now, the face and the facial skeleton is very important for facial aesthetics, the facial proportion. But in her case, as you move on with life, as you get older, the skin also tends to sag. There could be some issue happening with the soft tissues, the muscle and the skin. So we decided that we would do genioplasty with jaw sculpting. We would do an augmentative rhinoplasty with rib harvest, and also bilateral facelifts. So a facelift was totally a soft tissue procedure. The genioplasty with jaw sculpting, totally a hard tissue or a bony procedure, and rhinoplasty, as you all know, is a combination. So we worked on the bone, we worked on the cartilage, and we also harvested rib for her. Right. So we've moved from there to here with the help of these procedures. But when I started, I also said that we did some procedure for her alveolus or for the teeth, because she was also edentulous. I'm also going to go and show her scans before and now. But to tell you, she just had one tooth or two teeth. So we removed them, and our dental team, our implant team, they also placed several dental implants in the mouth. She's going to get a new set of teeth after a few weeks. But for the moment, she's going to go back like this and come to us later on. All right. So if you look here, we start from the nose. So you can see the augmentation on the nose. Her nose was broad. So you can see that it's nice now. We've made it as pointy as we can. We've let the ethnic features stay. We've reduced the width. And then moving on to the nasolabial grooving, you see that it's there. It should not be that it's not there, because that looks like a mask. It's there, but it's subtle. You can see the incision, it's healing up well. It's a little hyperpigmented at the same time. Right now, it's all going to become nice. Also look here. We were thinking of doing a lower blepharoplasty, but what we've done just with the rhinoplasty has improved this significantly. So we're going to wait for some more time before we decide if that's going to be done for her. Let's move down now to the upper lip. You can see it's become a little bit more stiffer, a little bit more tighter. But then the main thing is the lower lip and the chin. So the lip, which was really large, everted, pouty, has gone in. This height has increased. I'm going to show you the improvement in the profile as well, but first this view. And then you can see this nice shape here on the lower jaw on both the sides, and that's because of the facelift. So these are all the things that we've done for her in one go. All right, now we're going to move on to the side view. All right, and mind you, this is without any makeup, so she looked much gorgeous after a few more. Just turn a little bit. Yes. Now let's move on to the side view. And now you see the improvement again on the side view. Let's start one by one. So you can see the position of the upper and the lower lip. You can see the chin. You can see that this jowling, double chin, all gone. You see that lower border. It's beautiful. Look at that. That was curved. So we've enabled her to get this. Also with the help of tightening, you can see the incision there. It's healing very, very well. She's got a nice earlobe. Haven't done anything to that. We've let that remain. And this is the scar or the incision right up to the hairline there. That's from the facelift. But the changes you see is very nice. Got a nice angle and shape. And the nose also, you can see the nose. So the projection is nice. It's a gentle curve and the tip. All right. So we're going to show you a similar thing on this side. On this side, turn பண்ணுங்க. Yes. So you can see a similar thing from this side. Again, a lot of this soft tissue all the way till here. It's all been tightened up. The chin has got nice projection, good cheek contouring, and you can see the nose also. So these are all the changes that we brought into effect in all the different views. Anira parunga. Yeah, she looks very concerned on that picture before. All right, now we're going to show you her scans, right? So we have the cone beam CT scan here. I'm going to show you the scan on this side. Right, so you can see this is 16/4, and this is how she was. She came with just 2 teeth, you can see that, and the rest were all edentulous, and this is taken after the surgery. 34, this was 16/4, 34, 14 days hence, and obviously you're not going to see the soft tissue work here, but you're going to see the hard tissue work that we've done. So you can see the plates here, you can see multiple screws here. These are the dental implants that have been placed. You can see these 2 teeth missing because they have been removed, and you can see all of these changes. And now I'm going to show you the orthopenomograph, so you can one second, I'm having some issues with the cursor. Okay, no, I think I need to have something, but that's it. Yeah, this is fine. So there we go. Sorry about that. So that was her before. Again, we can see the date. This was 4/16, and this was 34. And so we've got all these screws inside, dental implants, plus you can see a plate and a screw from the genioplasty. So we used a very different kind of incision for her. That's very rarely done, if at all ever done, to combine multiple dental implants with a genioplasty, a dentular genioplasty. So the genioplasty was essentially done to improve the proportion, to also tighten the skin, to remove the jowl and the double chin. So I keep saying it's like a reverse facelift effect, and this time we've also combined it with a facelift. All right, I'm going to show you some more views for you, so you get a clear picture of what all we've done. And this is a sagittal view, and now I'm going to show you the axial view. So we're going to try and show you the changes in the nose, and I think it's very obvious straight away. See the shape there, see the shape here. There's some swelling in between, but that's because of the surgery. It's all going to go down. And there are some amount of rarefaction or artifacts on here. This has come about because of the dental implants. We've put in 12, and so sometimes when you take a CBCT after that, it just diminishes the depth or the concentration, and you can get some hazy lines like this. All right, now we're going to ask her some questions. She's a lady who speaks very, very little. She's unbelievable. She never complains, she never has any issues, but she never says anything much either. So உங்களுக்கு வலி இருந்ததா சர்ஜரி முடிச்ச அப்புறம்? கொஞ்சம் இருக்குதா? ரிப் எடுத்ததுல வலி இருந்துச்சா? எவ்வளவு நாள் வலி இருந்துச்சு?
5 days I think.
5 days almost you had slight pain. So she says she didn't have much pain on the face at all, but she had slight pain from the rib harvest for almost up to 5 days. அப்புறம் டயட்லாம் எப்படி இருந்துச்சு உங்களுக்கு? You had some issues with the diet? No, right? Or you had?
I will try.
Okay.
Yesterday, today, past these 2 days, I ate water sambar sadam.
Okay. And? And what else? You can use that. That's just a mic. They give you no problem. Yeah. She's still a little bit concerned because she doesn't have things. So yeah, and I want to thank you for having agreed for the short video, so that a lot of our subscribers, a lot of our patients who've had surgery, who want to have surgery, can all understand how multiple surgeries involving both hard and soft tissue can be done safely, predictably at the same time. So if you look around, a lot of them do not do it at the same time. The people who do the soft tissue work do not do the hard tissue work. If you do rhinoplasty, they don't do genioplasty, or it's like this. So now we've tried to combine everything, so to say, like a face makeover, which actually is beneficial for you because everything gets done in one go. And also by working on the hard tissue and the soft tissue, the results are going to be there for longer. So you know, that's the benefit of these kind of procedures. All right, so when are you going back now to your country?
I don't know yet, maybe another week, not tomorrow.
But in 2 days or 3 days?
In 2
Okay,
days.
so she's gonna go back soon. And when was the time you were really upset about anything here with regards to pain or anything? Were you upset?
Shifted out there.
Okay, so she wasn't very happy when you shifted out to the hotel.
The luggage or...
Luggage?
So
Okay.
I called the guy to help me.
It was a little bit of a problem. Yeah, I understand. Sorry about that. Yeah, she did come here with her sister, and I think upon her sister she left, right? She went back to Malaysia. So because of that, she felt a little lonely also, and then she was also recovering from her surgery. So yes, we try to keep patients.
First time surgery.
First time surgery ever. Amazing.
Never do surgery.
Never do
Never
surgery.
go.
To the hospital?
Never admitted in hospital.
That's great. That's a lot of courage. So she's never had any surgeries before. This is the first time for her, and yes, and you're happy.
Yes.
You're very happy. That's important. And what about your sister?
Only my sister saw my face.
Uh-huh.
My family members, so they don't know.
Oh, they will be very
Once
happy.
once they see me, really scared, they're shocking. எல்லாம் ஷாக் ஆயிடுவாங்க.
எல்லாம் ஷாக் ஆயிடுவாங்களா?
யாருக்குமே
ஹாப்பியா
தெரியாது.
தானே ஷாக் ஆவாங்க.
என்னது வேறமே இன்னும் பிரைவேட் அப்படி சொல்லுவாங்க.
No, she expresses it very well in Tamil. She's like, oh, they're going to be really shocked in a nice
My
way.
office people, I don't know how.
So what do you work in?
As an admin executive.
Oh, she's an admin executive, and you have told no one that you've come here except your sister. Incredible. So
We do discuss. நாங்க ரெண்டு பேரும் பேசுவோம்.
Discuss பண்ணிட்டு வந்துட்டீங்களா? Okay, that's nice. So I
She
think
always encouraged me.
encouraged you. Yeah, she's a very brave lady. She contacted me many times, many times, and she was like, my sister's feeling depressed. My sister wants to get it done. Doc, I think you're the best person and all that. She's a very nice lady. Don't worry, no. All right, so we're happy that everything went off well. Yeah, and we'll see you again soon because you need to come for your prosthetic work. I assume these are tears of joy, right? Not that you're upset with me or with any of the treatment here. Okay. All right. So thank you. You take care, and we'll see you again soon.
In September.
September, yes,
September
perfect.
first week, huh?
September 1st week, you want this? Yeah, September 1st week we'll have you here.
Okay.
Or maybe even August last week. We can give you an appointment and then you can come over. So one last time you can show that. You don't like?
No, new face.
Okay, fine. All right. She's like, she doesn't want to see the old face anymore. Yeah, it's fine. You've done the part.
Every day I worry.
Every day you were worried.
See my face in the mirror.
Seeing your face in the mirror. Oh. So you're happy now, right? We're very happy also that everything went off well, and even though you took this, big decision, traveling with your sister and everything. Yeah, and it'll get only better. இன்னும் நல்லா ஆகும்.
I don't even know surgery na எப்படி இருக்கும் அனுபவம் தெரியல. நானும் வந்துட்டேன்.
அதனால தான் வந்திருக்கீங்க தைரியமா. இங்க பாருங்க, இன்னும் நல்லா ஆகும். இது உங்களுக்கு இப்போ 2 வாரம் தான் ஆயிருக்கு. இன்னும் 4 வாரம் 6 வாரம் ஆகப்போ ஃபேஸ் இன்னும் சூப்பர் ஆகும். இன்னும் டைம் ஆக நல்லா செட் ஆகும்.
யூஸ் மை கிளென்சர்.
ஆமா, போய் யூஸ் பண்ணுங்க. யூஸ்
வரும்போது அவ்வளோ வெள்ளையா வந்தேன், ஒரு மார்க்ஸ் கூட இல்லாம. இப்போ
நிறைய கிளீனிங் எல்லாம் இல்லை 2 வாரம். இட்ஸ் ஓகே, மேஜர் சர்ஜரி ஆகப்போ அந்த மாதிரி தான் இருக்கும். எல்லா இடத்துலையும் பண்ணியிருக்கோம். வாய் உள்ள இல்லை, வாய் வெளியில்.
பிக் சர்ஜரி இப்போதான் தெரியுது. நான் ஏற்கனவே நினச்சா பயந்துட்டு நான் மேபி
வந்திருக்க மாட்டீங்களா? பட் உங்களுக்கு பெனிஃபிட் இருக்கும். உங்களுக்கு நீங்கள் அடுத்த 6 மாதம் கழிச்சு, 1 வருஷம் கழிச்சு, 2 வருஷம் கழிச்சு எப்பவுமே நீங்கள் நம்ம இப்படி ரொம்ப நல்ல காரியம் நடந்திருக்கு அப்படி. எனக்கு நிறைய பேஷண்ட்ஸ் அப்படி சொல்லுவாங்க. திடீர்னு 1 வருஷம் கழிச்சு எனக்கு மெசேஜ் வரும், ஒரு பேஜ் மெசேஜ் வரும். நான் அங்கே போனேன், இப்படி சொன்னாங்க, பழைய ஃப்ரெண்டு பார்த்தாங்க, இவ்வளோ சந்தோஷமாக இருக்கிறேன் அப்படிலாம். ஸோ இது வந்து ஸ்டார்டிங் நமக்கு கொஞ்சம் டிஃபிகல்ட் தான், பிகாஸ் மேஜர் சர்ஜரினா இப்போ 2 வாரம் உங்களுக்கு ஆகுது. பட் உங்கள் கான்ஃபிடென்ஸை ரொம்ப கூட்டி கொடுக்கும். அது மட்டும் இல்லை, நம்ம மற்றவங்க நம்மளை என்ன யோசிக்கிறாங்க அது நமக்கு நல்லா ஃபீல் ஆகும். உங்களுக்கு பாருங்கள், நீங்கள் போனப்புறம் உங்களுக்கு ஒர்க் அட்மாஸ்பியர், ஃபேமிலி எல்லாமே வில் பி பெட்டர். பார்த்துட்டு எங்களுக்கு சொல்லுங்க. எல்லாம் சொல்லி கொடுங்க. சரியா?
சீரியஸா அவங்க கேட்டா அவங்களோட பேர்லாம் சொல்லிடுங்க.
சரி, தேங்க் யூ.
My sister. Actually my sister தான் இன்ஸ்டாகிராம்ல.
ஆமாம், அவங்க ரொம்ப கஷ்டி. நான் எனக்கு நிறைய வாட்டி கான்டெக்ட் பண்ணி சொல்லிகிட்டே இருந்தாங்க, எப்படியாவது பண்ணோம், நீங்கள் பேசக்கூட மாட்டீங்கன்னு சொன்னாங்க. ஆமாம், ஞாபகம் இருக்கா? நம்ம கன்சல்டேஷன் கூட அவங்க தான் கான்டாக்ட் பண்ணாங்க, நீங்கள் பேசவே இல்லை. அன்றைக்கி கூட நான் அவங்களை கொஸ்டினாக கேட்டிருந்தேன். அப்படி இங்கே வரப்போ சொன்னாங்க அவங்க ரொம்ப, அவங்க இங்கே வந்த கூட சொன்னாங்க நீங்கள் ரொம்ப கொஞ்சம் அப்செட்டாக இருக்கிறீங்க, நான் எல்லாம் சொல்லிடுறேன்னு என்கிட்ட எல்லாமே சொன்னாங்க. அப்புறம் எனக்கு ஸ்டாஃப்னு சொல்லியிருந்தேன். அப்புறம் நீங்கள் மெதுவாக ஃபஸ்ட்லாம் பேசவே இல்லை, அப்புறம் இப்போ தான் லாஸ்ட் 1-2 நாள் கொஞ்சம் கொஞ்சம் பேசுகிறீங்கன்னு டாக்டர் சொன்னாங்க. எனிவே, சரி, டேக் கேர். நீங்கள் என்றைக்கு போகிற முன்னாடி டிக்கெட்